to the introduction of our third speaker, that is Dr. Sushma Appaiah. She is a decorated dietitian with 16 years of expertise in personalized clinical nutrition. She is a renowned nutrition and a health coach with a Ph.D. in food science from CFTRI, Mysore, which is one of our leading nutrition institutes of the country. And she has 8 years of freelance nutrition counseling for corporates. She has conducted health and nutrition awareness programs for the energy sector and personalized diet and nutrition solutions for various health issues. Her passion can be seen with her entrepreneurial spirit. She founded an organization called Golz, which creates unique programs for special needs children's nutrition, addressing conditions like ADHD, autism, epilepsy, among others. And in 2021, during when entire world was shut down, Dr. Appaiah founded Salutary Nutrifoods, an enterprise on therapeutic food formulations. So she has been recognized with numerous awards for her contribution to public health and wellness. Again, like Dr. Amrit and Wing Commander, if I go on for the rest of their accolades, I think we might have another webinar on it as such. So with all my heart, I welcome Dr. Appaiah to discuss the significance of men's diet across different age groups for their well-being and fitness. She will highlight how proper nutrition can aid in managing stress, preventing chronic diseases, and promoting mental health, offering practical dietitian guidelines. So everyone, please join me in welcoming Dr. Sushma Appaiah. Ma'am, the mic is yours.
Yeah, very good evening to all of you, and many thanks for having me here and granting me this opportunity to share this platform on talking about the men's health, and especially connecting the nutrition to the mental health and overall the health issues, which is very glaring for the men. Would you be sharing, Mr. Isaac, my slides, or shall I? Okay. So to start with, keeping the timeline in mind, it's 8 o'clock. So what is the health status of the men? When you look into the NCDs, and I'm very happy that Dr. Nanaya as well as even Mr. Narayan Madhavan also talked about, the health issues which is really struggling with our overall economy as such. It's not always the men or women, it is ultimately we who makes this nation or who builds this nation and the economy forward. And we are talking about the fifth largest or the very soon to be third largest economy in the world. I really wonder with this kind of health issues what we are having, that you can just see that, as it was already mentioned by even Dr. Nanaya also, 50% of heart attacks in men below 50 years, and out of this 25% are within the 40 years. And the Indian men has more than 2.5 times higher suicide rate than the women, which hardly is being talked. And in fact, last year's Men's International Day, that was the theme. And every year we are having the add up in the new cases related to prostate cancer. And 40% of the men don't want to talk about the mental health because of the main stigma attached that they are masculine and they cannot afford to be crying or sharing their emotions somehow, as it was being projected earlier. And somehow we have also got the reports from Economic Times 2021 poll study. 31% of men suffer depression in any one given time in their lifetime. But out of that, 1/4 only take the medical help and 1/3 only take the medication. And overall in the world, we have 41% worldwide the mortality rate, more among the men compared to the women. So the 10 major leading causes of the mortality is being impacted on men once again. And I'm thankful to Dr. Nanaya, who just gave a very detailed insight on the diabetes aspect of the men's and how the stress is linked to it. So if you look into the overall the leading reasons for mortality, you will find that all the cardio, CVD, diabetes, or the cancer and the stroke and hypertension, the silent killer, are all interlinked to the men's mortality, or they are contributing a lot in terms of their overall life expectancy, what we have in the Indian men. And they are also impacted more with the Parkinson, autism and skin cancer, and as well as the gout and various other disorders. So, being a dietary solution company, which firm which we believe in very firmly, we need to look into what can be the answers in terms of the dietary regulations. So, as we were just talking about the dietary regulations in diabetes, to start with, yes, we Indians, our diet is largely comprised of carbohydrates. We need to change the type of carbs which we are taking. We need to go for the more complex carbohydrates so that we can regularize the sugar spikes or the insulin resistance which we are facing. And I would like to tell you that in our own center, we find day in and day out the number of cases which we are handling now, or which people doesn't even know that they are diabetic, and they get into our clinic, and when we look into their symptoms and we get the clinical reports, we find most of them are already crossing towards the not only the pre-diabetic, many of them will have the HbA1c levels more than 8 or 9, which is very, very scary situations. Next slide, please. So I'm just giving an insight into these various disorders which is impacting the men. If you can just see that heart diseases, or whether these are the chronic issues, or what we can say the NCD or non-communicable disorder, which is causing 70% of the deaths in the uh, Indian population. And in that, if you just find the risk factors apart from the smoking, alcohol, or overweight, obesity, the diabetes, whatever is there, is their cholesterol levels or the lipid profile. So the excess body fats, the history, or even the stress levels also adds up to the fats. This is what I want to add up here. And the HDL levels are very much in our own hand. By adding the regular exercises and by adding the certain small modifications in your dietary, day-to-day dietary aspects, you can add up the omega-3, or the add up the anti-inflammatory in terms of the seeds, the various contribution from our own dry fruits, and dark leaf or the sopus, what we call, that is really very good, and fermented foods. These are really very important. Next slide, please. So when you look into again the hypertension or the silent killer, I would like to say that more than the women, by the age of 30 plus, the men are impacting by the hypertension or the high blood pressure issues. Simple changes like reducing the salts, cutting down on your processed foods, and cutting down on your refined products, cut down on the sugary foods. Here, I would like to say, everyone, any given time, if we consume more than 3 to 4 teaspoon of sugar in one single food, you are impacting your immunity and you are causing more stress. And it is exactly what Dr. Amrit was talking about, the flight or the adrenal and the cortisol turmoil. You are pushing yourself more and more towards that. And one simple example I would like to give here is your so-called energy drinks, so-called sugary drinks. In terms of the energy drinks, like it's not fair to give the names, but then most popular among the youngsters are these so-called energy drinks are loaded with artificial sweetness, synthetic caffeine, again not giving you anything other than, and then there is huge amount of phosphoric acid which adds up to your gastric and gut related issues, and excessive uh, salts. This is again another thing. Being a food technologist, I know that we cannot have processed food, or we cannot maintain the good quality of any food product without being added with either the sugar or the salt. But then there are 19 different names of the sugars, and there are more than 8 to 10 different ways the salts can be added. So if you are searching for sodium on your packets, you will not get it. You will be coming in the different various forms. So then you have the prostate cancer, which is again being now, I would say that IBS and prostate cancer is another area which I would say that is impacting a lot among the men. Just today, just before coming here, I had few, again the men portion again being more, they are coming here again to look into their nutritional aspect because they are gaining weight. So that is one thing which I would say is very good thing. But then what exactly is the concern is that most of the time the men doesn't get into clinics for their own health. They will bring their counterparts, they'll bring their children, but they will not ask for what they are needing. And that's the where I would say the alcohol consumption, smoking, and substance abuses is really very high, and the unhealthy eating pattern. Especially, I would say that even the blame even goes on to the sports fraternity, like IPL matches, various matches going on in late evenings. You sit post evening, late evening, along with a pack of some packaged food, and you are continuously munching or chewing, and you get excited. Also, you are eating more. When you are depressed, also you are eating more. Both the way, and that's where I would like to say you go into the aging and the weight gain again is the issues. So their hormonal changes, the muscle strength gets impacted. So you start taking very high amount of protein supplements. So that again is not the only answer. You pushing again to your weight gain in unhealthy manner once again. Yeah. Can I have that? Yeah. So how does the managing the weight, if you see all these issues which is impacting men largely is related to men, so overall weight and their lifestyle. So how do we manage it? So there is predisposed genesis. We know that if you are having a family history, you are having more concern towards the getting into any of these NCDs issues. Then the energy intake is maybe high, but then your physical activity has to be increased, and energy intake has to also reduce as per your own requirement based on your BCA or body composition analyzer, which gives a detailed profiling as to what do you need. The recent RDA, which has brought out the newer recommendation, says earlier we used to say 1 gram protein for per kg body weight of the men, but now we are telling it is 0.8 gram per kg of your body weight is the ideal thing. And getting a regular behavioral changes and modifications in our day-to-day pattern is extremely important to keep ourselves away from the stress, because stress are the precursors of most of these morbidities or the NCDs or non-communicable diseases. And clinical health checkup, just by not only thinking about going to the doctors also is not the right way, or going to doctor only when you are cross the border. That's not again the right thing. Nutritional health checkups and the clinical periodic checkups are very important aspect there. These are the very strong health markers. Next slide, please. So what should you do? You need to look into your personalized nutrition. The general Google GAN will not work anymore for any population, whether it is men or women. You need to have a balance between the mental, physical, and the spiritual thought only by pumping up your metabolism. So you need to move yourself more. You need to improve your protein type, the quality of your protein. You need to stay hydrated, not only by just by adding water, but we say there is a new adage. You need to eat your water. So eat more of fruit, juicy fruits, or the high water content foods. This is what you have to do, and you have to snacking right. So when you look into your visceral fat is one area which I would like to say is the one concern which you need to be checking up regularly as to what is my visceral fat, because this is the first indicator you are pushing yourself towards the unhealthy eating and the wrong lifestyles. Next slide, please. So what should be the dietary recommendations which you should be thinking about? More than 2 to 2.5 cups of fruits and vegetables. We have now come from out of the my pyramid to my plate. This is what is the recommendation by the NIN recommendations for the nutrition. Whole grains, in your total whole grains, there should be half should be the whole grains. So if you are taking 60 to 70% carbs, 35% should be the whole grains. It should not be just the rice. It should be less polished. It should be less processed. And you can add more of omega by adding 2 to 3 servings of fish per week. And quality protein is the crux. Don't just think about proteins, but also think about proteins which can be digested better with high biological value. And that's where the whole egg plays a real huge role there. Apart from those who are on the completely the vegetarian diet, you would say that portion size is very important. 5 to 6 serving per day of vegetables and fruits. So you can see 2 serving of fruit and 6 serving of vegetables. So 8 servings per day. Each servings of vegetable and fruit is equal to almost 100 grams. Please mind that. This is in general for all the age groups. And if you are above 70, you need to cut down on your overall fruits and the fiber, because gut cannot accept so much. And gut microbiota or the probiotics is the one era where the nutrigenomics and the gut specific bacteria are going to really improvise on your energy metabolism, pump up your metabolism, and help you maintain your body weight by burning your fats and distributing in an equal manner, and enhancing your calorie burning and not allowing your fats to go into the storage mode. That's how you can control your inflammation, and you can maintain your weight very effectively. So this is one area which is really taking up, and it is really required very much in nutritional way. So I would say your weight manager should not be just the weight. Low glycemic index foods should be the real lookout for you. Add more fibers, add more of the calcium rich foods, because it will take care about your leptin and your food regulation, the appetite regulation, and increase the fats and oil, which is more with the MUFA, the BUFA, or omegas or essential fatty acids. Next slide, please. So exercise is one of the most integral part, but people, we find that either they run to the gym, forget about the nutrition part, or the nutrition as such means to them, most of the people till the recent time, is just taking protein supplement. Unfortunately, that is not the truth. It is the nutraceuticals or the functional food which has to come onto your plate in the form of balanced diet, which is going to help you along with your exercise. It is always 60% is your diet or your food, and 40% is your exercise, the way you are customizing as per your lifestyle and your daily schedules. So it is very crucial to add these vitamins more in your diet, especially for men. This is what I want to bring out, is because when we talk about the hypertension, the potassium has to be really pumped up, and you will find them in most of the simple fruits like banana or skinny foods, and you can even think about avocado, even sweet potatoes. And iodine is very important, or thyroid gland. Hormonal balance is very important when either we are talking about insulin balancing or insulin production, or when you are talking about PCOD in women, or we are talking about the thyroid issues in the men. So this is where I would say the iodine plays a very important role, because your energy metabolism is completely dependent on that. And superfoods or immunity booster to very simple ones are the essential fatty acids. You can just see green tea, and the green leafy vegetables are the crux. You can add every day one meal with only with leafy vegetable will help you a lot in preventing as well as overcoming any of the communicable or non-communicable disorders like your lifestyle disorders. It is very, very helpful. Next slide, please. So very simple tips is never eat alone. Try to eat along with your family, which was the old traditional knowledge which we all had, and most of us were earlier following it, but now we all have our own systems, our own mobile gadgets, and our own programs. So we are sitting, the four members in the same home, sitting in four different places and gobbling their own food. We do not even talk, we do not even know what we are eating. There is no mindfulness in what you are doing, and that's what has to stop. And if you are into the job profile of corporates, you need to make it reminder to yourself, get up, walk every 1 hour in between your meetings, and the late working hours or the sleep hygiene has to be really, really taken care of. Next slide, please. You have to respect your uh, very famous author on the nutrition, William Walcott and Trishify, who said mindfulness. So enjoy your every moment, whether you are eating, whether you are working. Be passionate. There are many cases when you are not very comfortable with your own job profile, but then start looking out what is the best in that, and have your mind very positive. So this is what I would just like to say. And one more slide which I think I would like to just talk about is, before this we end this, is the sleep hygiene is extremely important. If you think that I am taking the 8 hours of good sleep, that's not enough. The time which you go to your bed is extremely important. You have to understand there is a particular protein which gets denatured every night based on the light and the dark cycle, and there is a cortisol hormone which has been explained earlier also, and also the melatonins. So till your sleep is taken care in the right manner and in right timing, that is the only way you can take care about your uh, avoid any of these lifestyle disorders, and men has to come out with their emotional thoughts. They need to talk to their people, either with their friends or their counterparts or their own friend circle, or even they need to have some time out, some good hobbies they have to inculcate, so that they can really impact, or they just have to, rather than just dipping themselves with the alcohol or drug abuse, they need to just come out of it, talk about it, communicate. And as Mr. Madhavan said very rightly, communication is one very important tool to think in a positive frame and get solutions. So, with these few words, I would like to say once again thanks to each one of you, and for making me part of this I would say, very thought provoking health platform for men. And I would be very glad to be continuing the part of this whole platform and contribute in whatever little manner I can. It'll be really my pleasure. And thanks once again to Ms. Nandita Prabhu, as well as Mr. Isek and Dr. Shalini, who is behind this whole program. And great sharing the with wonderful thoughts with my earlier speakers. Thank you once again.
Thank you. Thank you so much, Dr. Sushma, to the way you associated what Dr. Amrit said and what Wing Commander said to diet. Right? We need to live life associatedly. It's not just we communicate on one part and we stay sugar free on another part and we avoid something on another part. All of it has to come together as a cohesive whole. And your focus on the, let's say, the adrenaline cortisol diet axis, it is not a simple thing to look at, and the importance of sleep, the importance of managing endocrines, metabolism, all of these things. So we have to realize as audience that there are some things that we don't totally understand by just looking at Google or influencers. We have to leave it to the experts to understand the nuances and integrities of how we should design our entire lifestyle. And thank you, Doc. Thank you so much, Dr. Sushma. It was a pleasure for
Thank
you to
you.
shed light on such
Nice.
aspects.
Pleasure for me also. Great learning. Thank you. Yeah.
Thank you, madam.